Well, greetings everyone from Minnesota. I'm David Knoyer, and you've joined one in a series of conversations of We Can Do This Indian Country, part of the national We Can Do This campaign from the Department of Health and Human Services. And it's all about trying to keep all of us healthy through COVID-19 vaccine uptake. And we're focusing tonight our conversation on the Great Lakes. And we have guests from Minnesota and Wisconsin scheduled. And we would love any comments that our viewers tuning in might have, questions for our speakers, or thoughts and reflections from wherever you're listening from, Great Lakes or not. This We Can Do This campaign has been focusing on a number of different audiences over the last several months since the vaccines became more available right at the beginning of 2021. And the American Indian Alaska Native portion of this campaign has been developed by G&G Advertising. And G&G is a Native American ad agency based in Billings, Montana and Portland, Oregon. And the Department of Health and Human Services has funded this. And later in the show, we're going to show you a website with some resources for Alaska Native and American Indian communities. So there's a website that we can do this.hhs.gov. And as part of that campaign, the current phase is targeting young adults, right? The president's goal was to get all of us adults vaccinated at a 70% level by about the 4th of July. And in some places, it's on target to do that. In other places, it's going more slowly. So these ads that G&G and other firms around the country as part of the We Can Do This campaign have encouraged people to think about it, talk about it, consider it, right? If not for your own health, for the health of people around you. And right now, the campaign is focusing on young adults, 20-somethings, if you will. And I wanted to show you something that's playing on social media. I'm not a young adult, so this hasn't popped up on my iPhone yet, but this is a quick spot to give you a sense of where this campaign We Can Do This Indian Country is right now as we speak.
History, strength, resilience, vaccines, modern day warriors. Together, we overcome.
I really like that. Talks about resilience. We can do this together, modern day warriors. And I want to bring into the conversation now our first guest, the president of the Stockbridge-Munsee Mohicans in Wisconsin, President Shannon Holsey. And in a minute, we're going to hear from Commander Kailee Fretland with the Indian Health Service Bemidji area. But President Holsey, what's the status right now of COVID-19 in your community there in central Wisconsin?
Well, thank you for having me, David. Currently, we're really in a really good position. We have 0% positive. We are very proactive, not only in our vaccination endeavor, but we're also very proactive in the continuation of the social distancing, the wearing of face masks. And of course, we require mandatory testing every 2 weeks for all of our employees. And as the largest employer in our respective counties, that it really helps to manage things and understand where we are.
Wow, so you're a sizable force there. Shawano County, I believe, is where you're at, and the Menominee Nation is right to your east. I noticed on your website that you have an incentive for tribal members to get vaccinated. How did that come to pass?
We do. Well, we work very closely, David, with both our respective 11 nations in the state of Wisconsin. We did from very early on when it was declared a pandemic. And we recognized there was going to have to be some of that, as you talked about, that resiliency, that education, and all of those other things. And you talked earlier about that demographic or age group of the 20-somethings to maybe the early things with hesitancy. So we developed Since the pandemic, our tribal nation has developed about 800 documents, whether it be policies and procedures, SOPs, those types of things. But it's really been a collective endeavor, both from our federal partners, from our state governor, from FEMA, from a lot of different agencies, even CDC. So we recognized that was something that was going to be critical. And I always say it's a human experiment. It's a social human experiment. So we'll see if that really was responsive. So far on the tribal side, we were very successful. So we're one of those counties, though, that are only like 32% vaccinated. But of those vaccinations, our tribal nation has administered about 20% of them. So we were very aggressive to the point where we put a billboard. We worked with the governor. We worked with National Guard to help us vaccinate, to have drive-through vaccination events, to do it at work, to do different things, and to incentivize people because we felt like maybe there was a response. We've integrated the vaccination incentive for both our tribal members and our employees. And on the employee side, on the casino side, there was that larger demographic of that age group that you're talking about. But so far, in the past 2 weeks since we've implemented it, we've found that about we have about 50% of our employees on the casino side that haven't been vaccinated, whereas on the tribal side, we're at herd immunity. So, and including our citizens that live on reservations. So we're working towards that, but we've seen a huge uptick in participation. We offer all 3 vaccinations, and we're already also offering them to 12-year-olds. So we've been very aggressive trying to continue to educate, trying to do outreach, trying to assure. But like anything else, I attribute it to the success on several factors, including the fact that we're sovereigns, that we created flexibility in our methods of distributing the vaccination, and of course our cultural values that prioritize not only our elders but our community.
I didn't quite hear, you talked about, I just want to ask you a follow-up question. You mentioned, President, that the overall vaccination rate in your part of Wisconsin is not so high, but that the tribe of that percentage has delivered quite a few of the vaccines. What was that percentage of the local county that you have vaccinated?
So in the county, there's a 32% vaccination rate. We've administered about 20% of them.
Okay. That's quite impressive. And you said with the tribe, then your tribal vaccination rate is quite high.
It is very much so. We are at herd immunity on the tribal side, including our government employees and our tribal members. We are at about 50% on the casino side, but since we've implemented the incentive, we've seen a huge uptick in people starting to participate, or at least start getting their first vaccination. But we do offer all 3.
So that incentive of a couple $100 is not, people are at least paying attention to that, huh?
They are, I obviously it's a start, but it still requires a significant amount of education and dispelling, and I think Native American tribes have had long history in their lack of trust, especially where it, from the era of smallpox and in our relationship with IHS, but it certainly has evolved. And I think a critical part of that was just being transparent and educating people and having robust consultation. And I think the difference this time especially is because tribal nations really didn't expect to get access to vaccinations as quickly as we did. But speaking of the fact that we are sovereigns, we had a lot more flexibility, whereas counties didn't. But we not only coordinated with our local county, we coordinated with our governor's office, we coordinated with our Midwest region of IHS, we coordinated with CDC and FEMA. Our goal was to get people access to vaccination as quickly as possible by any means possible, and we were very successful in doing so.
Well, wow, it's really impressive to hear, 800 policies that the tribe has approved, all this coordination, and probably a relatively lean and mean, if you will, staff, right? You're not swimming with lots of staff members to do this work. I would encourage our viewers to post questions or comments as you're listening for President Holsey or for our next guest, who was Kailee Fretland, who's a pharmacist in Minnesota with the Red Lake Nation. But President Holsey, before we turn to Kailee, you're also involved with the Midwest Association of Sovereign Tribes, and you talked about the cooperation of the 11 federally recognized tribes in Wisconsin. What are you hearing from Michigan and from other members of MASS, that Midwest Association of Sovereign Tribes?
Much like David, much like our tribal nations of Wisconsin, there is close connection to our region. There are 35 tribal nations in our respective region of the Midwest, and the coordination efforts and the sharing of information was just as significant from a state level to a tri-state level, and all of that. I think they're finding the same successes because we're not going to reinvent the wheel. We're going to work smarter, not harder. We're going to share information, and there was constant engagement from our federal partners, our state partners. It transcended it, and there was a robust conversation too on a national level. I'm the treasurer for the National Congress of American Indians also, so there was a lot of coordinated effort, and so I attribute some of the success and of being able to do that. I know most recently too, a good friend of mine from Blackfeet Nation, they had high success too in their administration, and they had an Interpol or an international issue trying to get our relatives from the north to Canada to get those vaccinations, and they worked through their state senators and through the National Congress of American Indians to do that, and they were able to succeed at that because they didn't want any of their vaccinations to go bad. They wanted a shot in the arm to the relatives who wanted it, and they were able to do that.
Yeah, I saw that story, and it's something else that you said earlier was, as tribes, we didn't expect to have the vaccine so soon. It's actually a wonderful story of the last 6-9 months of how tribes have responded with so many partners, with the federal government in some instances, with state governments, with each other. And that story from Canada was the Blackfeet people whose homelands extend right to the north in Canada. Traditional homelands extend to the north in Canada. So the Blood Nation, and they have different names that they go by, all one people culturally, right? But I think 3 or 4 different distinct political tribes. And they found a way to work with the United States government, the Canadian government, to get people on both sides of the border vaccinated. And I suspect that Canada's had a little slower go at getting the vaccine, so it was probably more folks on this side of the border helping with their Canadian relatives.
Yeah, you are exactly right, David. That's exactly what happened. And I think initially what had happened was it was crossing the border in order to receive a vaccination from the United States, as you said. And so I know that their government worked with Senator Daines and Senator Tester to do that, to be able to administer that and to get through that sort of red tape, if you would. And so they were able to collectively do that, and no vaccination was wasted, and there is still that continuation of administration of vaccinations to our Canadian relatives as well.
Is the tribe there pretty much back to a sense of normalcy in terms of in-person activities? It looks like your late summer powwow is on schedule. Your casino's open. I don't know that we'll ever be back to normal, quote unquote, but is there pretty much mask-free? People are interacting with each other there as they did before the pandemic?
Currently, what we do is if you are on reservation, if you are vaccinated, you are allowed to go without a face mask, except for our health center. We still follow CDC guidelines. So we have a CBRF or a assisted living center. We have an elderly feeding center. We have a health center. Those are still required, as well as our casino employees are still wearing face masks, even if they are vaccinated, because we're serving the larger populace or general population. So we call it, we're dialing up. So we follow our trends, we follow our numbers, we meet daily with our executive team, and we discuss it. And we also look at CDC guidelines. We let the medicine and the data drive us. So however that looks is, but we are intending, because we think that our powwow is a traditional powwow, so it's smaller in nature, but I assume there's going to be a lot of people, because people are really looking for ceremony as that good medicine this year. So I'm sure we're all anxious to get back to that normal. But to your point, David, I think we're going to see this they're talking about a variant and they're talking about different things. But I think we just have to be mindful. It's at the heart of this is a collective responsibility for all of us to protect our community, and however that looks. So I think we'll be hyper vigilant and continue to follow the data and let that drive our decisions, however that is, either dialing up or dialing down.
Awesome. Well, if you're able to stay with us, President Holsey, for a while, please do. But I wanted to bring in Commander Kailee Fretland, who can help us with some of these other questions. And Commander Fretland is with the area office of the Indian Health Service, who's one of the partners in the We Can Do This Indian Country campaign. And Commander Fretland, you also served on the Indian Health Service vaccine task force from the beginning, when I think Operation Warp Speed was on everybody's front pages back then. What's your experience been with this warp speed? You hear President Holsey talk, and it sounds like a lot of it was supposed, as we say, drinking from a fire hydrant, just a lot coming at everybody. And it seems like people have been pretty heroic in making it happen. And we appreciate your service on the task force. But what has it been like going from those days when we had so many unknowns about the pandemic to today, when we know that there's a number of vaccines that will work? And now we're trying to, right, as the president said, let science really guide us.
Yeah, David, you're absolutely right. I think whoever named or dubbed Operation Warp Speed aptly named that early on in the campaign, because it did move really quickly last year. And although that did raise a lot of concerns for people of how quickly the vaccines were studied, developed, and rolled out, I think we've really certainly seen the impact. As President Holsey said, her rates of COVID in her area are 0%. We're seeing the same rates in my area. So we really are seeing the benefits of vaccination and how that's working. But this has been an unprecedented year where we have all learned, I think, so much. We've all gained a lot of different skills, and we've really seen how when we come together, government to government, agency to agency, how we can communicate, how we collaborate, when we are transparent in our processes, all for the betterment of the public, that we can really accomplish amazing things as a country.
What are the main questions that you've been hearing about the vaccines? Right, there was some concern that because the process, the trials, the clinical trials, went quite quickly, it may not have necessarily meant that steps were skipped. It's things were condensed, right, because of the sense of urgency. But in your chair now as a pharmacist, what kinds of concerns are you hearing from the average person of how do we get shots in all arms?
Yeah, that's a good question. Early on, there was just a lot of uncertainty because the Pfizer and the Moderna vaccine were new platforms. They were mRNA platforms. And I think there was a lot of early concern about, one, the speed at which they were developed, which things were condensed a little bit, but really things were run in parallel. So no step was skipped, but they were really run in conjunction with each other at the same time. Or normally we would do it in a very sequential manner where we would start with phase 1, then phase 2, then phase 3, and there wouldn't be this overlap. And so early on, it was just, I think, the unknown of the mRNA vaccines, the speed at which they were made, not really knowing the effect that they were going to have. And so just that unknown, I think, caused a lot of people across the nation to be just a little hesitant. But I think what we saw those first few weeks of people coming in and getting vaccinated, and just the hope and the joy people had knowing that they were now vaccinated and they would be able to see loved ones that they hadn't seen in months, give their family members hugs, be able to do some of these celebrations that we hadn't been able to do, I think was amazing. And that really kept the ball rolling, even for those who maybe were just a little bit doubtful and wanted to sit back and wait and see what was going to happen with the vaccines. And so now we've got new data that really shows how effective the vaccines are preventing serious COVID complications as well as hospitalizations. And even data now showing that we're still having some ongoing immunity after we've been vaccinated, which is really promising. I think we anticipated that we would be doing boosters pretty soon afterwards, and that's not the case. And so I think that has really played out. And now we're getting to this point of this a little bit younger generation, but some of the concerns are, I know some of the recent ones I've heard is that people are worried that they're going to be sick and they're not going to feel good for several days, and they don't want to go through that. They're like, well, I haven't gotten COVID yet. I'm tested negative. The rates are really low, and I don't want to just have a weekend where I'm laid up and sick and don't feel really good. Or I've got a lot of kids to take care. I've got kids at home. I can't afford to be sick and not feeling very good. So those are some general concerns that we've been hearing. The other is that, I've made it this far. I'm negative. I don't need to get the tests or the vaccine at this point. And so I think there's those. And so I think it's important to be able to listen to what those concerns are. I know as a pharmacist, we really try to listen to our patients, as all healthcare providers do, and really not shove facts down their throats and tell them why they should be doing something, but really listen to what their concerns are, because those are valid concerns to that person. And then ask permission to be able to share the information with them. And one of the most powerful pieces is that anybody who's coming in, most of our patients, if they are coming in and testing positive for COVID, they have not been vaccinated. So the only people that are testing positive, at least in our area, are those who have not been vaccinated. And that's really a powerful message to be able to share with patients, is that the people who have been vaccinated are not testing positive. They're not ending up in the hospital. They're not having to come in and get monoclonal antibodies. They really do have that protection.
Yes, and I think nationally, right, we're seeing in those states and areas that have had low vaccination rates, their number of infections, their rates of infection, their rates of hospitalization are higher. So it's an inverse thing that it's like that pulley system, like you said. And there was good news this week, right? That they had all been kind of telling us that we were going to need probably a booster shot at some point, like we do with some other vaccines for the Moderna and Pfizer vaccine. But it looks like now that we might be all right if we don't have widespread variants, right? Is that the caveat?
Well, I think it's still being studied. So at this point right now, we do have extended immunity, but that is still going to be a constant evaluation that they're going to look at of what that immunity is long term. So that could change as the variants change, as we learn more about the people, as we've been vaccinated, we'll learn more about our immunity and how long that's going to last. So we can say that that's definite for the future, but we can say for today and this week that that's good news for right now.
Good answer. President Holsey, do you have any comments based on what you're hearing Commander Fretland talk about from the Indian Health Service perspective for the Bemidji area?
No, I think exactly the way she's describing is the way that it is, and I think it is ever ongoing. And I think the fact that IHS has been as responsive as they have been, and there are weekly calls, there has been extension of outreach, and we are all trying to, the endeavor is to get vaccinations in arms however we can do that, and continuing to have robust dialogue and educate people on the safety levels of it. And I agree with her. Our numbers indicate, just as she described, if people are testing positive for COVID-19, it's those that are not vaccinated.
Mm-hmm.
And you're getting, you said you were having your employees at the casino tested twice a month. So
we still get our employees. Everybody is tested twice a month, and we open it to the public. It's an initiative through the National Guard, but we also offer it at our health center. But through the efforts of National Guard, they come in every 2 weeks on behalf of the state of Wisconsin as a free testing site. So we do our employees as well as open it to the general public.
That's awesome. Are either of you hearing of any particularly creative outreach efforts happening in our neck of the woods in Minnesota or Wisconsin or Michigan? The Stockbridge-Munsee tribe is giving financial incentives to tribal members who haven't been vaccinated. I know here in the Twin City of Minnesota, just today there was a 2-hour open clinic. Anybody come without an appointment at one of the urban Indian clinics here. Other things happening that you all are hearing?
Well, I think definitely the incentives are a big draw for those tribes that do have them. And so we've seen that quite a bit. Some of the other things that seem to have worked really well is if you have someone who is really well respected, and it could be maybe a local celebrity, some local athletes, but like coming to your events and doing a meet and greet so that the folks that are coming to get vaccinated have an opportunity to meet someone maybe they've been looking up to. So that's a great draw if you have someone either in your local community or maybe someone who went on to do some acting or singing or athletics, but they can come back to the community and do meet and greets while people are getting vaccinated. Has been really good. Food always seems to bring people in when we can offer, even if it's something small like root beer floats or, maybe a meal at the same time, seems to work really well. And the other piece, and one of the things that we found has been really successful in some of the areas that have achieved quite high community vaccination rates in that 80 to 90 percentile, is really that they rolled vaccines into routine care really early. So through their ED, through their walk-in, through their clinics. And then they did patient call lists, and they called individual patients who hadn't been vaccinated yet and invited them to come in for the vaccine, letting them know how they could access it. Because we do have our usual patients who come in for routine care, and then we have a lot of patients who don't come in generally for routine care. And then finding out how we can get vaccines out to those folks, whether it's going to where they are, if it's the elderly nutrition meals, if it's community events, if it's even sending out our health technician or our nurses out to the houses and doing home visits and vaccinations in the home for those homebound patients. So those have been some really successful strategies for our communities who have done well in achieving community immunity.
I love those ideas. Very simple. I think everyone has been kind of looking for the silver bullet, the magic wand here. And you can't, as you said, Kailee, Commander Fretland, just tell people what to do or give them facts without permission, right? And I love how you said, I need to ask for permission before I start telling you all this stuff that I think I know and I want you to think about. But root beer floats, I haven't had a root beer float in a long time. Wow, right? I bet some of these young people don't even know what root beer is.
I have a 3-year-old, 6-year-old, and 9-year-old, so I feel like root beer floats are common at my house.
and then inviting back kind of star athletes, right? We never forget the high school stars, and not even stars all the time, right? But maybe people that went off to college or people that we haven't seen in a while, and having them around for a double incentive to come together around a root beer float and a vaccination and, maybe a piece of fry bread or something.
There you go.
Let's, before we transition here, I want to play another spot from this We Can Do This Indian Country campaign that talks about the we in this. And often in this country, things are defined, health is often defined about me and what's in it for me as an individual. And yes, that's true. But in Indian country, the first thing is maybe how we fit as a collective, right? How I define myself in terms of the family or in terms of my relatives or the community. And so in addition to the spot that you saw at the beginning about modern day warriors and vaccines, there have been some other spots on the radio about the sense of we-ness. So let's hear one of those spots that have been playing on the radio.
Hello?
Hello.
Hey, who's this?
Who's this? It's your Auntie June.
Oh, what's up, Auntie?
Your drum group. Were you practicing last night?
Yeah.
It's a little quiet.
What?
How many people are in it?
6?
Ah, I thought so. It did not sound like it last night. Sounded like dog water.
What's that supposed to mean?
Ah, jokes, Sonny, jokes. But let me just say, we could definitely tell there was the 6 of yous.
Well, only 3 of us got the COVID-19 vaccine, so we had to do what we could.
Ah, well, as the leader of the group, you need to be that positive influence and help them all get vaccinated. Maybe give them a ride to the appointment or a call reminding them.
Yeah, you're right. I'll let the others know. The vaccines are safe and effective. Plus, anyone 12 and older is eligible to get vaccinated now.
Attaboy. Now start making those calls before I do.
No way. I'm on it.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
I like that spot. What do you think of that when you hear that, President Holsey?
I think it's a really important reminder, especially from those aunties, right? I think it's really important. We use that, perhaps not that, but what I appreciate about not only Native Americans is our sense of self, but our resiliency, and we're grounded in that, but we use that to our advantage. We too did that as well. We had our very young and our older elders do public service announcements to remind people how critically important it is to get vaccinated, and that, that we hope that successful vaccination efforts change the narrative and really highlight the power of Indigenous people to protect each other. And that really is key, and it's critical, and it's the absolute truth.
Thank you. Dr. Antony Stately, thank you for joining us. Dr. Stately is the CEO of the Native American Community Clinic in the Twin Cities of Minnesota. And you've been watching this pandemic for more than a year now. And I was tuning into your website for a while, waiting for the vaccinations to be unleashed, COVID-19 update at the top. And I tune in every day and I'm like, oh, when's it coming for us? When's it coming? When's it coming? How's it going these days, COVID-19 at NACC, Dr. Stately?
It's, it's going well. As soon as we were able to get that vaccine, which would have been, I think we got notice on Christmas Eve that we were going to get a shipment, right? And it was like, I think it was the day before Christmas Eve, and NAC was supposed to be scheduled to be closed on Christmas Eve and Christmas Day. And, I had my staff pivot and let's make sure we get that shipment of vaccine. Let's figure out how we're going to roll it out immediately next week. And, and I have the most amazing staff on the planet. I think they, on the day before Christmas Eve, when they're supposed to be shopping for gifts and thinking of others and thinking about their food and their presents for their children, and what they did was they prioritized the need for our community to get that vaccine, and we figured out how to stand up an event in 4 days. And the first group of people we vaccinated was a group of elders who came together and prayed over that vaccine, and and started from a good place with prayer to Creator, that this vaccine would help our people and help our community. And I think because we started in a good way, in that way, we were, I think, it wasn't all unicorns and rainbows, but it was fairly good. And we had some struggles early on where we weren't sure if we were going to get some supply, and then all of a sudden it show up, and and I think we just had to we had to do a lot of pivoting in those early days. And things are certainly different now. We vaccinated many elders in the Twin Cities and surrounding area. We vaccinated, we were one of the first communities to pivot and start vaccinating 55 and above as soon as we were able to. As soon as we felt we had saturated most of the elders 65 and above. And then, we and NAC and Indian Health Board worked really closely, collaboratively, very early on figuring out how to solve this problem for our community. And we stood up vaccine events fairly rapidly and a good response. So we're doing well. We could be doing better now. You can see look at any of the charts from the state of Minnesota, and you can see the vaccine rates are kind of declining, right? Where people are less excited about it. Lots of people don't come back for their second one, which is a problem. So, we could do better, but things are good. We're in a good place. I think we can be in a better place if we make more effort.
You yourself had COVID.
I did.
Antony, what was that like?
Oh, wow. That was, I got COVID the week before Thanksgiving. My son got it first, then I got it, and then pretty much it moved rapidly through my family. My twin boys got it, myself, my partner got it. I was the only one that ended up in the hospital. I was in the hospital the week of Thanksgiving. Not a really fun time to be in the hospital. They tell people like healthcare providers are like the worst patients on the planet, which is true. Like I waited till the very last minute to go to the doctor. My sister was like threatening me on the phone. She's like, "Go to the doctor. I'm coming over there. I'm dragging you out of your house," or kind of thing. And there was a moment where I think the hardest moment was like when I got into the room, they admitted me. And then it kind of dawned on me, like I might not see my kids again. And that was a hard reality, right? I was terrified, I think, at that moment. Kind of broke down and cried a little bit for a while.
So, how long were you hospitalized?
7 days. 7 days. They immediately started me on, I think it was the first thing they started me on was remdesivir. And then added something else. I think I can't remember the antiviral. After that, I had a great doctor. I went to the little hospital right here down the street from me, and in Shakopee. I didn't want to go to a big, huge health system because I wanted to be close to my family. But it's an indication of like how I wasn't really thinking clearly. Probably the lack of oxygen to the brain. I wasn't breathing very well. But my kids wouldn't have been able to come in and see me anyway, but I wanted to be close to them. It was important for me to do that. And so they were great. They were wonderful. They took really good care of me. They talked to me. They explained things to me. I asked lots of questions. And they were patient with me and the questions I asked, and it was, but it was hard. I think one of the hardest parts of being in the hospital too at that time was, it was Thanksgiving week, right? And so I could hear, the hospital the floor I was on, and the ward I was on was kind of the COVID unit. And
I think he froze up a little bit, Dr. Stately. I was wondering if that was him or me. Dr. Stately, there he's back.
Yeah, sorry about that.
Yeah.
Anyway, the hardest part was sometimes listening to the people in the hospital crying, wanting to go home, and just thinking, oh my gosh, and I would sit and I would pray for them as well as pray for myself. And I was never so happy as the day I walked out of that hospital and got to come home to my family.
The sense of isolation, I think, was one of the most challenging things of this from the very beginning, right? There were so many things at the outset of the pandemic we didn't know, right? Scientifically, we just didn't know. So keeping people apart, particularly folks in assisted living and nursing homes, are just terrible, right? Those pictures of talking to people through the glass, if you can even do that.
Yeah. I mean, I have relatives and friends who had to, say goodbye to their families through that little iPad, right? And I just, the idea that I would have to say goodbye to my children at that moment when I was there was just like the one thing that kept thinking like, I don't want to have to do that. And, I think I've told other people this story, but I called my sister my second day there, and I was like, hey, I left so quickly, I didn't bring any medicine with me. Can you like bring some medicine and leave it at the front desk, and they'll bring it up to me? Like, bring me some cedar, sweetgrass, sage, some tobacco, bring me a shell. That second night there, I was like, I held that shell on my lap, and I prayed, and I just said, really simple prayer to Creator. I just said, please let me stay. I have like children I have to raise, and I have, those boys need me, and as much as I need them, and I have some work that I still want to get accomplished in my community. And I just said, I want to stay. Please let me stay. Right? About 4 days later, I was out.
How did your boys are older than 12? How did they do with the vaccine? And I guess the one that was sick got well.
Yeah. They did well. They both got sick, but one had it worse than the other. But when they got the vaccine, they did okay the first shot. The second shot kind of like, they themselves had heard stories from like their friends and other people about like, I got sick after the second vaccine. So when the time came for me to take them to get their second vaccine, they were like hemming and hawing, and one of them said, I'm not going to get it. And I was like, okay, let me answer some of your questions and concerns. And then they still hemmed and hawed, and I was like, well, you don't get a choice in this matter, actually. You're my child. I'm your dad. We're going to go do this. This is important. This is about keeping you safe and making sure that you're going to be protected. And that's my ultimate job and responsibility as your dad, right? So, yeah, it turned out fine. They had like, mild cold-like symptoms, and for 24 hours, and then they were done. So.
And they got through hockey season okay, and so
they
forth.
got through hockey season okay, and they had a week where they couldn't go to hockey and actually I think that was our 2 weeks when they couldn't go, and that was when he got it. So we shut down for a month, and then it picked back up in January. But they got through hockey season great. They took first place championship in D6.
And that was an incentive, you think, for other players to get their shots?
Yeah, it was interesting because like my sons would tell me like other friends of theirs on the hockey team, and then friends of theirs at school were really ambivalent about getting the vaccine, or their parents were ambivalent about it. And I think it was helpful for some of their friends and the people in their social circle to see that they had gotten it and that they were fine, and they were really active afterwards. And they remain active, and they remain in good health. So that was, that was important, I think, too. I told them, I said, that second shot is your ticket to being out in the world without a mask. And they would complain about all of the things that I would make them do to keep them safe. And I was like, if you want to be out in the world without a mask, it's still got to be somewhat careful in some environments, but that's your ticket. So if you want that, this is the path. Yeah.
That's a good selling point. And it's kind of interesting how quickly, because Minnesota was pretty cautious about mask mandates. And then it didn't take a week or two where suddenly, they were almost optional in shopping, grocery stores and what have you.
Yeah, but I think when we opening back up, once we hit that 66% tile thing, the governor loosened the mandate, the mayor of Minneapolis loosened the mandate, and then you started seeing people kind of out and about. I did have to have conversations with relatives and other folks who I knew had not been vaccinated, or who like had ambivalence about getting vaccinated for whatever reason. Some of them had health concerns. Some of them had previously bad experiences with other kinds of vaccines, so they were hesitant. But I had to talk to them about those experiences and tell them, like, okay, other people might not be wearing masks around you, but until you get a vaccine and until you are sure that you're going to be okay, you should mask up around them. Don't be too, excited about taking off your masks. Because you could not only, I had a cousin who was like, well, I've already been sick. And I said, well, you're immune, but you could still acquire the virus, and then you can take it home to your babies, right? And she has like kids who are under the age of 10. And so just try to remind people, like, okay, this isn't about like just me taking care of me. This is about me taking care of my children, me taking care of my grandparents, me taking care of the people I work with, me taking care of, even the people, in Walmart who I don't even necessarily know. I have a human responsibility to take care of those people who are human relatives that are, my blood relatives. And I think that, I love the piece you played about the weenus, Rich, and that little radio spot there between the auntie and her nephew. I think it's important that we remember, like, we are a community that is stronger because we have family, and because we have community, and everything we've ever survived that's ever been difficult for us as a people has been because we stood together and fought it together, right?
Mm-hmm. Dr. Staley, let me bring in another guest with us tonight, and you probably know Deanna Standing Cloud. You were talking about people with children, and
don't say it.
And hello, Deanna. How are you?
Hi, Deanna.
She's on. You're muted. I don't know if we muted. Maybe we muted, knowing.
I'm mute. I was drinking a carbonated drink, so I didn't want to burp on air. Like, no.
Please don't.
I gotta
no burps.
Getting old.
No burping. Your little baby is past burping. How old is your little one now?
She's 16 months. So, and then when people ask that, I say 16 months, and they're like, well, what does that mean? But she's one. She's very precocious. I know what that word means now, so I could bust it out. She's healthy, and we are so blessed to have such a smart, healthy baby. So yes, she's one.
Yeah.
And your son is not how old is he?
My son, he's 13. So
Okay.
he's going into the 8th grade. So, and then I also have my stepdaughter, Kailee. She's 15, and I think she's going to go into high school. She's incredibly smart. And then I have a 22-year-old who's not in the house. She's has her own apartment. So that's actually really good for our relationship.
So how did you feel about vaccines for your 12-year-old?
Well, you know what? To be honest, you guys, I was all about, like, I never got the flu shot. I never, I was like against vaccines, and there's these, there's conspiracies and things like that, and I was really against it. But after thinking, like talking with my family, talking with my partner Mike about, like, what are the, we were researching together, and then, it came down to, like, our spiritual leaders. So those who have mentored me, Ida Downwind is a mentor of mine. And then we also got an email from Tony Troyer saying that you couldn't be a part of you couldn't be on the grounds for ceremonies this summer because if you weren't vaccinated, because there's, elders out there, and we don't want to put elders at risk because, so many first language speakers in this pandemic have passed away and it just kind of, increased their illness, and they just, a lot of them passed away. So after I kind of thought about, like, the spiritual leaders in my life, my entire family, except for the exception of my daughter, the 1-year-old is fully vaccinated. Well, actually, my son gets his booster on the 12th of July, but we've made the decision because my spiritual advisors, recommended we do that.
Awesome. Ida's doing well?
Yes, Ida's doing well. I haven't seen her for a while, but she's strong. She's got good spirits. She's good medicine.
Right. Or earlier, Dr. Staley had talked about, the key to taking off your mask is to take the shot, right? So I think that makes a lot of sense, particularly for those of us who are tired of the mask, and the mask is pretty hot, right? This is the hot weather that we've been having. And then Ida and Tony Troyer tell Deanna, hey, the price to entry of ceremony is to get a shot. So it's pretty clear.
Yeah, I had the good fortune of being able to go into a lodge about a month ago, and there was only 4 of us in there, but the 4 of us had all been vaccinated, right? And I was like, so we all felt good about being in there and praying, and I was in the moment there, I was like, oh my God, I haven't been in a lodge for over a year, and I was like, it just felt like I felt my heart crack open, right? I was like, at one point I was weeping in the lodge because I was dealing with something really difficult. We had just had a loss in our family, and so it was like, okay, this is worth it. This is worth it to be with people I love and to be in ceremony and to be, social again and to hold space with people and to hug people again and feel good about it, right? So.
Dr. Staley, the vaccine has been available for 12 and older for a while, and our native population is so young. I think the median age is 10 years younger than the overall population. Are you seeing more kids at the Native American Community Clinic?
We're seeing some. I'd like to see more. We haven't seen a significant amount of, we haven't seen as rapid of a response as we did initially. I think folks kind of have some ambivalence still. And what I tell people is talk to somebody, talk to a relative that that has had their child vaccinated, talk to a relative that you might know, talk to your pediatrician, talk to your doctor, ask questions, stay off of Facebook and stop reading all those posts from people that kind of say crazy things there's a chip inside there and they're going to track you. It's like, I actually had a conversation with one of my cousins about that, and I was like, I want you to listen to yourself. Do you hear how crazy you sound saying that? I'm like, do you have any idea how small that chip would have to be to fit through that little tiny needle? Right. And so I just try what I try to do is I try to encourage people, if you're scared, you're ambivalent, talk to people you trust, like Deanna talked to her spiritual advisors, talk to people that you trust, that aren't going to, pull the wool over your eyes, that are going to talk to you truthfully and honestly and forthrightly, and, and ask questions. And, I heard somebody was saying this the other day, I forget where I heard this, somebody reminded me of this. It's like, courage and bravery isn't about not being scared. Courage and bravery is about being scared, being afraid, and doing it anyway, and powering through. And in this context, this is exactly what we have to do, right? This is exactly what we have to do. And our children, we are a very young group of people. We are young. We are a young nation. If we were to lose many of our young children, it would devastate our communities and our nations, right? And so I just want to encourage people to do, talk to people, get information, ask questions. What I do when I don't know what to do, I pray. I ask for guidance. I pray. So, these are all things that Creator gave us. He gave us a mind, a heart, an intuition, and the power of prayer.
Deanna, how did your son do with that first shot, the first dose? Physically?
It was physically, he said that he was sore in his arm. Other than that, he was swimming, and he's actually in Green Bay now with some lacrosse kids, and he's the same. It's not like it wasn't a huge physical implication on him at all. It was, it was fine. And I actually thought my physical reaction would have been greater, because I had a couple of folks in my office who actually had a stronger reaction to the second shot and didn't, you know, they didn't even come to work, or so I was kind of bracing myself for some pretty wicked symptoms, but it was fine. I was like, what's going to happen? But it was, you know, I feel stronger, and I really appreciate what you said, Dr. Stately, because it wasn't an easy decision for myself, because I'm like, at what time does the government put us first, and why are they issuing these vaccinations to our community first? Usually we're invisible and everything else. So I was really suspect, but after, you know, visiting with elders, like I just had an elder today in my office, and I was helping her with some an application for rental assistance, and it was just really good to just be there and be present with her, and not have to worry about the virus. And we actually got to hug, and you know, she's a first language Lakota speaker, so it was just really helped me today. So it was good, and we talked about the vaccination, and she said she got hers, and it was good to embrace her and to actually feel somewhat normal again. So
That's great. I was wondering if your son was in Green Bay trying out for the Packers, because aren't they going to lose their quarterback any day now?
I don't follow it. They always try to like talk smack about Vikings when they're here, and I'm like, I don't care, you know. And I thought about it, and I said, I guess if they were winning, I would care. But whatever.
Did you convince your partner Mike to roll up his sleeve, or was he on board pretty early with the vaccine?
Well, he's actually the one who was kind of encouraging me, and he was, you know, we watched a few videos, and he's actually at Metro State now, so he has access to a lot of like medical journals and stuff like that. So he was really doing a lot of research, and you know, we just made the decision based on a lot of that information. So it wasn't me convincing him. It was like him saying, you know, we have a baby, we have a family to raise, and we have to be strong. So, you know, he actually encouraged me. And then after, you know, my mentors, it was just kind of like a no-brainer after that. And now that I feel healthy and good and strong about my decision, I know I made the right one. You know what I mean? So I'm glad everybody kind of talked me into it. Mille Lacs Band had the option for Mille Lacs Band members and family members, so that's where we went for our Moderna shot. So we headed up to the res, and it was, you know, it was really cool to be in their new space, and it was a good thing. So I felt like I made the right decision.
Excellent. Dr. Stately, what are you hearing about making the vaccine available to younger children? We saw a comment here that someone has an 8-year-old. Yep. Is that coming soon, or what are you hearing?
I think that I've heard a couple of different conversations. I think we're very close to making that happen. I have heard that Pfizer has had some very good results from their clinical trials, and I think that it's going to happen very soon, probably quite possibly within the next few weeks, right? And that would be wonderful. I think it would be great. Like I'm hearing that they're having really great results, and that they might be looking at vaccinating folks as young as 2 and above here within the next 2 to 4 weeks, which I think would be an amazing thing, right? I think about how much our children missed out on over the last year. Like my own kids, like, you know, being a parent and trying to do school with them online was like, if there was anything that ever caused us to have the worst relationship ever in our lives over the last 14 years, it was that last year where I was like, and at some point in time, I was just like, okay, I'm not going to bug you about this anymore. Like having a good, loving relationship with you is way more important than knowing algebra, right? And so I eased up on it. But I think, our kids, they want to have, that they need social time. They need time with other kids. They need to be in groups. They need to play. They need to skip and laugh and giggle and sing songs and read together. And, they need to just be in those spaces. And that's the ticket for us to be able to get back to that space. And, and I think that they thrive when they're together, right? They weren't meant to be with their parents 24/7, right? I don't think.
God, no.
God.
Deanna, how did you do with homeschooling?
Oh, it was rough. So we live in a pretty small apartment. I'm here. I really enjoy the school district, and the school district has been awesome, but it was rough. I mean, he had band like first hour, so and he had a
like 8 o'clock in the morning band,
and it's like he's like and
trombone. What'd you say?
A trumpet, like
trumpet.
That was a thing. Whatever.
Yeah.
Reveille, that'll wake you up, right?
It totally woke us up. So it was, and these walls are paper thin. So he's like blowing that dang thing. And oh man, it was rough. And then, like he'll come wandering in and I'm like, well, what's going on? Why aren't you on your computer? And, he's like, oh, it's a break time or study time. And it's like, you're so busy with other stuff. You don't really necessarily have time to like check on that kind of thing. So it was, there's so many frustrations and different nuances that you didn't even expect would come up. So I was so happy to get that boy up out of here. I love you, son. I love you, but you got to go.
What grade was he?
He just finished the 7th grade, so middle school. Yes, all those hormones, stinky feet, all those the things that boys, stinky boys, and to eat a whole bowl, like a whole box of cereal in one day, and it's like what I'm cooking, So there's just so many crazy things.
Well, if you want stinky boys, Anthony's got 2 hockey bags for you.
Oh my God, yes.
I can only imagine the smell up in there.
Nothing worse on the planet.
Deanna, you're a powwow MC these days, and if you go online and look for powwow schedules, it's really hard. I did that today for a friend who's got a friend coming through town, and the Circle newspaper, right, hasn't been putting out editions like they used to, right, with this whole calendar in the back. What are you hearing from your powwow schedule, and what's the situation with your emceeing, and where do we go see you when you're next available?
Well, I don't think this is official, but I was in talk with potentially Powwow for Hope. emceeing that. They asked me before the pandemic hit if I would MC that powwow. So that's the only thing I have on the horizon at this point. But what I'm thinking is like people are not sure how to kind of like with the social distancing, and they're kind of like pulling this together at the last minute and then just getting those flyers out. So that's kind of my sense. I actually missed the Leech Lake powwow this past weekend. I had family come this weekend. So, but it looked amazing. And I think people just want to be together, and they just want to, and I think that's kind of what the pandemic taught us, is how much we appreciate these things, these celebrations. And I don't think that we really appreciated them the way that we do now. And it's like the colors and the sounds and all the senses and the smells and the fry bread and just laughing and the dust even, and the crusty old like outdoor, BFI bathrooms and 50 kids and, aunties laughing and coffee spilling. And there's something about that that's so, it brings us all together as intertribal people, like all across Turtle Island. So I think it's a magical thing, and I feel like we all appreciate it a little bit more. And with this vaccine, it's bringing us back to the circle. So I'm excited. I know there's not, I'll probably hit up a powwow or two. I know I'll be working at Mille Lacs, but Powwow for Hope is on August 28th. So that's going down. I'm excited for that.
That's awesome. Commander Fretland is saying the Red Lake powwow is next week. And historically, Sisseton has had a July 4th powwow. I guess it's on. But as I said, it was hard to confirm some of these things. Anthony, were you trying to jump in and say something?
No,
Okay.
I think I agree with everything that Deanna said. I think, we are social people. We need to be near each other. I'm excited because the Shakopee Mdewakan Sioux community, I think, announced that they're going to have their powwow again. I live right down the street from them. It's like one of the most amazing powwows ever. It's like the longest grand entry in the world. It's like takes an hour and a half for everybody to get in that arena.
I think that's mid-August too.
Yeah, usually around this third weekend in August.
Well, speaking of going online for resources, don't leave me, Dr. Stately and Deanna, Indigenous parent. I love how we just call you Indigenous parent now, Deanna.
I have many hats.
Can I give you mine? I've got a couple. They're 19. I'm sending them your way. This is about We Can Do This Indian Country, and there are some American Indian Alaska Native resources at this wecandothis.hhs.gov website, and I just want to point those out for folks. There's posters on there. There's a number of different things, fact sheets for tribal leaders. So the website is wecandothis.hhs.gov. And at the top of the screen, in that top navigation bar in blue, you go to resources and toolkits. So you click on that, and then down the left navigation bar, if you scroll down by audience, you will see the little box for American Indian Alaska Natives. And when you click on that, the American Indian Alaska Native resources pop up. So go check those out, and you'll see some folks in masks and masked up and bandaged, I guess is the right word, since we don't want to give Band-Aid any more business. But check that out, wecandothis.hhs.gov, and there's a number of resources there to help you make this case and get the word out at the next powwow, at the next social gathering, at the next parent meeting, and just get the conversation going, right? It's about having a conversation. And Deanna, I love your stories of talking to people about this and trusting, trusted messengers. And I think some of the trusted messengers in our community, they vary. Deanna, you're a trusted messenger yourself. I think you probably have more Facebook followers than Antony and me put together. But they are physicians and nurses as well, and pharmacists, like we had Commander Fretland on before. So thank you for sharing that powerful story of sitting with this issue, right, and then making a choice. Who are you hearing, though, Deanna, that's still on the fence? Because I know you know a lot of people, and what are some of their questions or concerns?
I'm hearing majority of people who are for the vaccination, actually. There was a couple of aunties in the office not long ago who, I mentioned that we have to get vaccinated before we go to the ceremonies, and she got all huffy, and she was like, God, what the heck? The white men, we get, our ceremonies. And I was like, and it kind of made me, I wasn't trying to feel bad about it. I was trying to think of like her perspective, and then she did say, why are they offering it to Native people first? And so there's a little bit of hostility, right? Because it's there's still that trust issue between Native people and and the government, and with a lot of these mass graves that are coming up, we're just going through so much, and there's like we still feel a distrust with institutions. So it's a very difficult decision for us as Native people to do these things. But as warriors, we're left with tough decisions to make. So, I mean, all the leaders in the past and all the leaders now, they're left with tough decisions, and it's hard to weigh that stuff. And you just really have to, like, Dr. Stately said, you have to follow your heart, and you were given a heart for a reason. And that heart gives you access to, what the Creator is trying to tell you and what the spirits of your relatives are trying to tell you. So it really takes some effort and some intention on like really making a good decision. So so that's, I mean, I've only heard a little hostility, but not, I mean, as far as everyone else, a majority of the folks I've talked to are on board with getting the shot. So
that's awesome. I got my shot pretty early in April, and it was at the other clinic, Dr. Stately, and it ended up being at the Indian Health Board in the Twin Cities. And boy, they were really good about, and you're probably the same, reminders, right? I think I got 4 or 5 texts and a couple phone calls, and just lovely people. Once you, as you said, your staff has been heroic, and the staff there were super nice too, and just very attentive. And it has been amazing to see people come together around this.
Yeah, I think one of the lessons we've learned, not only like Deanna mentioned, like how much we might have taken for granted some of the things that are really wonderful about our lives. I think another lesson we learned was just how much we can achieve when we come together collectively and collaboratively. We were able to achieve some amazing things this year, right? And I hope what we do as we come out of this is that we remember what it was like to do that work together and work collectively and collaboratively. Because even after the pandemic ends, we have a lot of things that we have to solve. Right? We have a lot of challenges and a lot of problems in Indian country that we have to solve, and we can get those things accomplished much more easily, maybe not easily, we can do a better job of doing it if we work collectively and collaboratively on things. And nothing like having to work hard to save your own life and the lives of other people that you love to kind of sort of teach you that lesson. But I have no idea what it was like to live back in before with my ancestors, but I imagined it was hard and it was arduous and it was difficult, and and you had to put your head down and put your feet in front of you and do the thing that was in front of you, and continue to do that so that you could get to the other side. I use this story, I talk about the story of the buffalo and the storm, about how buffalo behave when they see a big huge storm coming on the prairie, right? They come together and they move right into that storm, and they get through it faster. But on the other side, it's dewy grass and rainbows and unicorns and all kinds of other stuff, right? Well, maybe not unicorns, but but I think those are really important life lessons, and I try to tell my sons that all the time. It's like, remember, this is about sacrifice, hard work, paying attention to the needs of others, paying attention to your own body and what you need, and working collaboratively as a family, as a community, and as nations to do the things that we have to do to take care of each other. It was the reason Creator put us on this planet, right? We were put here to take care of one another. And nothing has tested that more, I think, prominently in anything in my lifetime than this thing, right? That I can ever remember.
It sure helps to have a common goal, right? A common enemy, if you will, to beat COVID. Yeah. Well, I mean, we've seen this with some environmental issues too, right? That when we're together like that, miracles and wonderful things do happen, and sometimes it's challenging to get together. So how do we keep this going for the next COVID, for the next variant, for the next challenge?
Yeah, I mean, I think those are all things we have to continue to remember, how to coalesce all these things. We got to keep the memories at the forefront of our minds. Not be too overly confident. Be happy that we're here and we're in a better place than we were a year and a half ago. But also remain vigilant and kind of watch, right? Watch the horizon, like the buffalo would watch the horizon to see a storm, and then they'd react, right? Kind of treat that in the same way. Use all of our senses, our intuition, our intellect, our power of prayer, and I think we will continue to do good things, and we'll solve problems as they approach us. We'll do it better and more profoundly if we work together. And I think that was one of the greatest lessons we learned this last year.
Deanna, you're really plugged into different parts of the community, and Dr. Staley is as well. I mean, I've seen you in the leadership network realm. I've seen you in the lacrosse family, extended family. I've seen you. I know you've done work with CHOE and language revitalization in the past. Powwow MC, funny lady. What? Now that we're coming out of this pandemic, there's been a lot of talk of mental health, right? And we talked earlier about isolation. How do we heal? How do we not just forget about this and move on, right? What's next for us to work through this?
Man, I really like what you said. I keep calling him Dr. Staley, Antony. But no, I liked what you said about, we have we reflected on what we do have and the gifts and the blessings that we have. So I feel like if we just return back to just our tobacco and using that, and if anyone, I try to use my tobacco every day. I know I've skipped many days, but when I use that, I know I'm transmitting, and I'm also receiving important information that I need to make my life healthy and to make my family healthy. So that's always like the first thing that I think of, because it's so fundamental, and it's such a good practice to cultivate, is using that tobacco. And then just being like appreciative of your family and really thinking of their skills, their talents, the things that they bring to the family, the unique gifts that they have, and just really like bring that out in them. I think that's, we have this life, and we have the ability, and we're gifted this time here, and we're all here for a reason. We're all here at this very moment for a reason, and we're having this conversation for a reason, and we may change the lives of somebody listening to this in some way. So I think just really being aware and being present, and being in the moment too. I think a lot of us kind of lost, we were so in the hustle and bustle, but when we were quarantined, it was like, hey, we're in this moment. And, with the riots last year and so many things happening in the past year, it's like we're in the present moment. So I feel like this is like Creator's way of saying, hey, we have to like look around at what's around us, and we have to make use of this this moment now. So that's how I feel like I want to heal myself, because it's so basic, but it's still so powerful, and I feel like it will not only heal myself, but kind of ripple out to my kids and to my coworkers and my family. So that's what I'm thinking.
Yeah. Well, I think you hit it on the head with the being present for each other, and putting the phone down, turning off the TV, turning away from the screen if you need to, and really just listening. And I think our kids have gone through really, really awful 15 months, whatever it was, right? Stuck at home. I went through 2 virtual graduations, a virtual high school graduation and a virtual college graduation, and they were nice, right? But there was just this whole sense that nothing was as it was supposed to be happening last year, right? And our kids, right, they had to deal with this. They had to deal with parents that weren't really equipped at times to help them, schools that weren't really equipped to help them, et cetera, et cetera. So I want to play one more message of collective strength and we from the We Can Do This Indian Country campaign before we say goodbye. So don't hang up yet. We'll come back. Here's one more radio spot that talks about us.
For us, the circle is everything. Our ancestors survived by sticking together. Today, life is a bit easier, but our challenges are not. COVID-19, a disease that has hit our communities hard. Now, more than ever, we need to stick together and keep the circle strong. We need everyone, young and old, women, men, rural and urban. The circle calls on us to care for and encourage others. You not only have the voice to share your knowledge that vaccines are safe and effective, but the ability to help your family and your community members. It might be as simple as helping them to make the appointment or giving them a ride. It's our time to complete the circle.
We can do this. Go to vaccines.gov to find vaccines near you. Paid for by the U.S. Department of Health and Human Services.
Not bad, huh?
Yeah.
Oh, what?
Yeah, that's a nice.
I just love the voice of these aunties. Deanna, I can't wait till you're 20 or 30 years older because you're going to sound just like that.
I'm practicing.
Yeah, she could probably do it now if she really wanted to.
I could. I just have to get in the zone.
Yeah. Reach down deep and grab those acting genes and
Unleash them.
Well,
are you writing a play? Are you working on any plays lately?
I actually am. It's a like more adventures about that one that you actually came to
Oh
see.
no.
Yeah.
Awesome. Well, I can't wait to see it. Awesome.
Yeah.
Yeah. I think one of the things I want to just remind everybody, I want to take a moment and remind people, like, this was a year of isolation, and, we're going to get busier and hustling and bustling. And some of us might not be able to do that. And so I want to encourage people, like, check in on your elders. Don't leave them alone at home by themselves, especially we're not completely out of the woods here. Call your aunties, call your uncles, check in on them, bring them a dish, go have a cup of coffee with them, make sure they have the things that they need, because a lot of times our elders get left alone, and gosh, if they got sick and they had to die alone, that would be really the most horrific. I can't imagine like anything worse than that. So check on your elders, let them know that they're important, and you'll feel good about it too. So.
Deanna, any closing comments?
No, I mean, just with that visit that I had today, I didn't, I was kind of I had things to do, and she just kind of popped up and at the office, and I was like, but I was really happy to have her sit with me. And I just, as Native people, we just need to connect. I mean, just to sit there and have, coffee and just rattle off whatever is on your heart or on your mind, and just visit and talk. And I think that's the medicine too that'll get us through this. And I know Zoom kind of was our saving grace throughout the whole thing, because my first Zoom meeting, I remember I got all ready. I was like curling my hair because I haven't been around people in so long, and I was like, ooh, I got a Zoom meeting, and I was like, what am I gonna wear up here? So it really goes to show. I mean, I'm a flaming extrovert, but even introverts need to be with people. And I'm really thankful to be on the show tonight and have this conversation with you guys, because you both mean a lot to me, and I appreciate being heard tonight. So thank you for inviting me tonight.
Thank you. Yeah, David, thank you so much. I haven't seen you in over a year. They're going to open up Gatherings Cafe again here soon. Let's go have some sweet potato hash and hang out. I would love to. You make me laugh like nobody else. Make me laugh.
He's known me since, he moved away, but he remembers me when I was a baby, and we just picked right back up, and we have good medicine when we laugh. So, yep, you're one of those people. I'm like, I can't hang around you too much in a public place because we might be too loud or something. So.
Well, thank you both, Dr. Stately. Thanks for your time, and Deanna, you were an extra bonus. And I know Native Roots Radio, Deanna, would love to have you on more often. That's our media partner who's doing these regional town halls in conjunction with We Can Do This Indian Country campaign. And Native Roots has been a great partner, Ogama behind the scenes, and Robert Pilot and Lewis So thank you to them. And for more information, tune into that website, wecandothis.hhs.gov. There are American Indian and Alaska Native resources there that can help you make this case to get more people talking about more shots in arms in Indian country, so that we can hug all of our vulnerable people, and even the people that we don't want to hug, we can hug. So Antony and Deanna, thank you so much. Dr. Commander Fretland earlier, and President Shannon Holsey from the Stockbridge-Munsee Mohican. So good night, everybody. Stay safe, and we'll see you soon.
Good night. Take care.